The Newsday continues here on One News Now. I'm Riza Diaz. President Duterte once again defended Health Secretary Francisco Duque III after the Commission on Audit found deficiencies in the handling of the agency's funds. In a state address, President Duterte said that Duque has never even handled public funds. Duterte added that all documentations for transactions made by government agencies are delayed due to the implementation of skeletal workforces during the pandemic. He explained that some of the health department's funds were not used as the DOH cannot spend all funds in just one day due to insufficient personnel. The president is also asking COA to give agencies sufficient time to respond to the audit findings. Despite this, Duterte has reiterated that he does not see any reason to remove Duque from office.
Do you want me to fire Duque, Secretary? Gusto mong paalisin ko? Give me a reason bakit ko paalisin. Ikinuha ko yung tao nakiusap eh. Hindi naman niya nag-apply. Nakiusap na, hindi naman nakiusap na kunin mo ako. Ako ang kumuha. So kung ano pagkakamali niya, sa akin yan. Pero nakita ko, you want to ask him, for what? Ano ba ang nagawa niya na kasamaan? I will stand for Duque, even if it will bring me down.
Meanwhile, the OCTA Research Group reports that new COVID-19 cases in Rizal province are surging. The group said that Antipolo, Cainta, and Taytay had sharp one-week virus reproduction growth rates. The healthcare utilization rate in the province also remained above 70% or at the critical level. The OCTA Research Group also warns that the positivity rate in Rizal stood at 29% over the past 7 days. Meanwhile, other provinces in Calabarzon, such as Cavite and Laguna, are seeing a slowdown in the increase in new cases. OCTA says the news single-day record of 17,000 cases was higher than they projected. OCTA research member Professor Guido David told One PH sa Totoo Lang that the surge they initially saw was underprojected. But he added that if it weren't for the 2-week lockdown imposed, the country would be seeing higher numbers.
Under-projected pa yung surge na nakita natin, yung nakita ng models namin. So this is even worse than what we projected. But this is real now. This is a real surge. It already started last week, 2 weeks ago. Pero now we're feeling yung talagang intense effects niya.
A member of the Health Department Technical Advisory Group says that the ECQ was not implemented as it should have been. In an interview with The Big Story, Dr. Ana Ong Lim said she expected that the recent implementation of the 2-week ECQ will be the same as last year. Ong Lim said that the strict quarantine classification was imposed to bring down cases, but it was not implemented properly.
Well, there are projections, and the reason why the ECQ was implemented in the first place is that we expect the numbers to go down. But we all have to admit that this ECQ is actually not what we expected. I think one of the things we have to also think about is how do we achieve the limit in mobility that ECQs are supposed to achieve to be effective.
Meanwhile, lawmakers pressed the health and budget departments over their purchase of overpriced face masks last year, as flagged by the Commission on Audit. Marian Enriquez with the details.
Lawmakers questioned the Health Department's transfer of 42 billion pesos to the Budget Department's procurement services during the resumption of the House Committee hearing on public accounts. That amount was supposed to be used for buying medical supplies and equipment. Lawmakers asked how it had happened without a memorandum of agreement and other paperwork. The DOH tried to justify it, saying a MOA for such common use items isn't necessary. On top of that, the items in question were overpriced. The masks were 27 pesos apiece, while the shields were 122 each. Recall that the DOH itself released a memo stating that suggested retail prices of masks should be 2 to 4 pesos, while shields should be 26 to 50 pesos. Bayan Muna's Carlos Zarate also emphasized that the DOH could actually make the procurements itself. He sounded the alarm over a possible conflict of interest.
Isang ahensya na nagtatalaga ng budget, in fact, very powerful ang DBM, Mr. Chair. Sa mga sinasubmit na budget ng mga departamento ay pwede ito mag-decide na kaltasan, no? Sabihin nila ito lang ng budget na pwedeng ilaan sa inyo. Tapos eventually, a big chunk of that budget that they approve will go back to them, no, in the form of procurement. So something is wrong there, no?
The DOH had also asked the DBMPS to secure COVID-19 vaccines in its behalf back in January 25. But the DBMPS said it denied the DOH's request.
We do not have the capability to handle the nationwide rollout of the vaccines.
It also noted that no funds were transferred for the supposed vaccine procurement. In any case, the DOH's earlier transfer of billions to the PSDBM resulted in the expiry of about 2 billion pesos in savings, an amount that an exasperated Zarate deems as a huge waste of taxpayers' money.
Maraming dapat nagamit pa ang 2 billion na yan kung ang DOH ay ginamit niya yan to augment. We are saying na August na, ay hindi pala nakapark sa PSDBM. This is for reversion to the Treasury Department, no?
The Senate Blue Ribbon Committee will hold another hearing to investigate former Budget Undersecretary Christopher Lau. Lau allegedly oversaw the procurement of the overpriced equipment for the DOH. For News 5, Marian Enriquez, we are One News.
The Private Hospitals Association says Health Secretary Francisco Duque III was, quote, misinformed when he blamed hospitals for the delay in paying benefits of healthcare workers. Speaking to the Chiefs, Private Hospitals Association of the Philippines President Dr. Jose De Grano said most of private hospitals still have not received the funds for the Special Risk Allowance or SRA. Recall that during a Senate hearing, Duque blamed the private hospitals for the delay in the payment of the SRA. De Grano added that some funds are coursed through LGUs and thus are encumbered by the bureaucracy.
Palagay ko, Secretary Duque was misinformed on this by his yung subordinates niya at sinasabi sa kanya, nabigay na po namin niya sa hospitals. Well, in fact, nung kami mag-survey, ang daming hospitals na hindi pa nare-receive. Paano namin i-release yan kung hindi pa namin nare-receive yung mismo pera?
Some health workers say they feel demoralized after hearing the COA's report on supposed deficiencies in the Department of Health's funds. Jen Kalimon with the story.
It's already past midnight, but healthcare workers at San Lazaro Hospital were still providing assistance to patients at the triage. They said this is their devotion. During each breaks, they were seen sharing light moments as if they don't face any challenges. Nurse Jamie De Guzman contracted the virus in March this year and got sick for more than a month. But she did not receive her supposed 15,000 pesos compensation for a moderate case.
A week after June 7, pumunta ako doon, sinabi na cut off na nung June 7. Ano po yung sinabi nyo pagka yung nagka-COVID? In line of duty naman ito, tapos may compensation kang 15,000 ka. Tapos sabihin na biglang
De Guzman also lamented that her special risk allowance starting December 2020 was only given last month. What's even worse is that she received only half of its 30,000 pesos expected SRA. But for her, she was still fortunate because many of her colleagues did not get their allowances at all.
And ayun ma'am yung pinakamasakit eh. Diniprive ka na, and in order for you to really get that benefit, any benefit, you have to fight for it. Kailangan i-struggle. Hindi ba pwedeng it should be given freely?
De Guzman admitted that they felt more demoralized when they heard about the report of the Commission on Audit. Recall that the state auditors flagged the Health Department for its deficiencies in the use of some 67 billion pesos.
You feel na nanakawang ka ng dapat para sa'yo. So imbes na these little things, these benefits are supposed to boost the morale kasi nga, hailed as heroes, di ba? Very thankful, pero we don't really feel it from the government.
But despite the lack of sleep, support, and time for their families, she chose to continue on her duty.
Everybody is still fighting. Yun nga sabi ko let's not allow other people to put out our fire. We have to keep fighting. Kasi hindi pa tayo tapos.
De Guzman called on the government to give the benefits they deserve as frontliners. Reporting for News 5, Jen Calimon, we are One News.
And those are the top stories of the hour. Join us later again at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on a Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.